Hi, I'm Dr. Molly with Your Goals Physical Therapy. Let's talk about running. So I absolutely love running, and anybody who has ever gotten the running bug knows how addicting it is, or addictive rather it is. And it is very hard, even when you're hurt or injured, for you to want to stop to run. But what do you do if you have pain in the front of your hip after you're done running, or even during your run? Like, how do you get past that? Having hip pain, especially in the front, is very, very common when you're running. And honestly, it doesn't even matter if you're new to running or you've been running for a long time. That kind of pain can happen basically whenever. And so I just wanted to go over how to talk about that, because I have met a wonderful woman, Sarah, who completely was in love with running. Anybody who, again, if you've been a runner, then you know that a lot of times that's your therapy. So Sarah was like, you cannot tell me that I am not allowed to run, because that is just not okay. I have kids, I have a husband, I have a job, and running is my zen time. I can put on my earbuds and I go for a run, and when I come back, I am a normal human again. But the last few weeks, the doctor told me that I wasn't allowed to run, and that is just, it's just not okay. I have to be able to get back to running. This is killing me to not be able to run. And the pain is bad, but it is not as bad as not being able to run. And I think that most people who got the running bug can relate to Sarah's position, because it is so hard to think about not running. The idea that you're going to give up 3 weeks or 4 weeks worth of running, you feel like you're gonna lose all of the training that you've ever done in your life. Not to mention, you're missing out on that peace of mind and the emotional release and just the calming effect that running has on you. It really becomes just part of who you are. You are a runner if you've ever caught that bug. And so when you have things that pop up, like front hip pain, every time you're trying to pull that knee up, and it just, after a while, you just can't even, you're barely lifting it, and you're sort of almost dragging it so that you can just take that step forward. So I just want to give you a shout out that there is hope. And in the case of Sarah, she came in, and it was like she could run for like a mile or half a mile before the pain started, but once it started, she was basically hobbling the whole rest of the time. So it was really kind of ruining her run. And she was willing to deal with that, but then she started having it all the time, right? So then when she's walking up the stairs, she was feeling that discomfort there, and it was just progressively getting worse. And so she went to her doctor, and the doctor told her, well, just rest it for a while, try heating it or icing it, whatever, and just don't run for 2 weeks and see what happens. So she took the doctor's advice, and she went home, and she didn't run for 2 weeks, and then she was like, all right, my 2 weeks is up, I'm going out for a run. And it was almost worse. So she was like, I couldn't even make it the half a mile that I was before the pain started. And so, I mean, it was fine walking around the house now, but it wasn't any better. And it was almost worse when I was running. So she's like, so I'm a little, defeated, and I feel like there's not really a whole lot of hope for me at this point. So, does that mean, are you gonna tell me that I can't run ever again? And I said, well, let's look and see what's happening. So after we did the evaluation, we look at how she's moving, her hip strength, flexibility, overall balance. There's a lot of things to look at. That gets a little tedious. But we were able to figure out the reason that she was having that hip pain. And we were able to adjust her training program. We were able to strengthen her hips. We were able to strengthen her ankles. We were able to work on her balance a little bit and give her a little bit more of a robust training program to go along with her running program. And so now she's running 5 miles without any problem. Because it's not really the running, it was something that was out of balance for her. And so it's, and rest is really good. So it's nice that she got a little bit of rest. But ultimately, rest is kind of a relative term. And so we rested the muscle that needed to be rested, and then we strengthened the ones that needed to be strengthened. And so she didn't have to truly take off like a full rest kind of a thing during her work with me, but she was able to allow the muscle that needed to heal that time to heal while still feeling like she could get her workouts in. And that is, I think, a nice little balance, right? So you still get your nice workout, you get your Zen moments, and you end up with no pain at the end. So I just want to let people know that that is possible, because I know, as all of anybody who's gotten the running bug, the idea of an injury taking you away from your running is absolutely devastating. But there is hope. Even with hip pain that hurts every step that you take, you can get back to running without any limitations. And I hope that this information helps. If you have a runner that is struggling right now, please send them this video. And if you want to contact me, I will leave my contact information below the video. I hope you're having a great day.